Okay, we're going to call to order the City of Franklin Board of Health meeting, August 12th, 2024. And missing right now, Deborah is excused. Dr. Golden's not here yet, and Denise is not here yet. We need approval of the minutes from April.
Move to approve.
Okay, any second?
I'll second.
Okay, any discussion? Hearing none, all in favor of approval of the April 8th meeting?
Aye.
All right.
Okay, opposed? We will move on. We have no citizen comment period and no unfinished business, I do believe. Oh, that's probably Dr. Golden. Or could be Pat.
Did you have to go all the way around?
Yeah,
Shouldn't we?
I need the steps.
I got
Oh, great.
Hi, Pat. For the record, Pat Neeson is now here.
All right.
Okay, and I do believe there is no unfinished business.
Correct.
So we will go right into new business, administrative updates, and the 2025 budget.
All right, I wanted to provide an update because we are in budget season for the city of Franklin. So we submitted our budget documents early this month, and we did again do the multi-request with PD, Fire, and Health, all requesting a .33 FTE to equal one full position for a social worker to start for the city of Franklin. This was asked for last year but not funded, but it will hopefully be funded and then assist with social service referrals and calls for service with EMS, things of that nature. So we've found that when people utilize 911, oftentimes an early intervention could help decrease the number of times that they need to call or need an emergent response, requiring less crew to go out and then less demand on staff. And then it also frees up health and EMS for other needs as well. So collectively, we feel it's a great decision. So we'll see where that lies after the budget season. And then the health department budget is staying fairly stable with just a slight increase
Dr. Golden.
in operational cost requests. So that is where we're at with that. And then one other important thing to note is that our Drug-Free Communities grant that we were awarded in 2016 that funds the coordinator of Volition Franklin, our substance misuse coalition, is refunded for years 6 through 10, but in October of 2025, the grant will be entering the 10th and final year. So we're really trying to figure out a great funding stream for that. Likely we'll see it in a budget request as an FTE. Always looking for supplemental grant funds, but to be able to fund that on hard dollars would be a really sustainable way to keep Volition Franklin around. That's all I have for budget updates.
Mike, where do we look at? Are we looking at it for the social worker from your position?
Oh, from Laura?
No,
Or
from
Mike?
Mike, as an older person.
Pardon?
Do you think that'll pass?
I have to look at it. I'm not sure. I mean, I haven't seen it. Have you got any guidelines from administration on what they are looking for the directors and the budgets?
Yep. So we all were to submit our operating budgets
Okay.
earlier this month, around the 3rd or 5th. Health department has no request for capital budget, so those were also due in. And then mid-September seems to be when the budget meeting will be going up before council.
Because I'm all for it. I mean, I'll support that, no doubt. Like almost everything else. So,
Yes.
it all works. We'll see how it comes out.
We
Okay.
will.
And now student internships.
Wonderful. So before we get to Laura, I'll give an update on some of the other projects that we've been working on. And those interns are not with us here tonight, but I will do them justice, hopefully, by explaining their projects. But Maliko is our AHEC intern, so she was with us for the length of June and July. And she worked on a Mugs for Rugs program, looking at data and doing interviews with the fire department. And then Carol in our health department, who works with older adults, we have found that there are many, many falls happening in Franklin, And according to the CDC, they're the leading cause of unintentional death among those over 65, which is, we're seeing huge prevalence here. So oftentimes EMS will be called, not necessarily for a medical emergency, but just because someone has fallen and they can't move. So a way to combat this is we've seen done in other communities doing programs to collect scatter rugs, rugs that are less than 4 feet by 6 feet, because those are a slipping hazard. So she has worked to kind of rally input and buy-in from municipal partners with fire, health, and call around to coffee shops. And tentatively Big B is on board that we would have some kind of health department and community organization sponsored collection site, and individuals who bring in their rugs would then get a mug that says Celebrating Quality of Life, designed by Malika, and then they would get free coffee one time in the mug. So hoping to serve both as unity and then also an opportunity for individuals to get rid of their scatter rugs, but then also raise awareness of fall risk. And that your house might be the way you've lived in it for 40 years, but we need to look around for any environmental hazards that might contribute to falls.
Do we, if they do turn in a rug, do we give them like maybe a flyer that tells them what kind of rug to replace it with, or something that they should be looking for? 'Cause
We'll say no rugs,
No
avoid
rugs.
rugs,
Is that
yeah.
what you're saying?
Well, and scatter rugs are especially dangerous. So this program would specifically be for, I believe it's under 4 feet by 6 feet. And also because we didn't want to collect gigantic rugs at any kind of community location, but those would be the most effective to get rid of to decrease the falls.
Now I'll remember, no rugs.
Yeah,
Right.
anything that your foot can get under and trip, it's gonna send you to him,
Right.
That's right.
broken hip.
My grandmother, I used to take all the throw rugs out. She'd throw them out, and she'd send her son out to pick them up again. I left.
Oh.
It's a fight.
It's because she didn't have this mug to remind her.
I
Right.
think it's also a generation, like, yeah, my grandmother, like, every place had to have a rug. Like, just be perfect.
True.
Don't want to
That's the solution.
But anyway.
But the Franklin Fire Department provided data that approximately 50% of calls are fall related. And then also, and this also ties into our social worker, because we could do an intervention at the first or second fall versus the 10th.
How many of those had broken hips or fractures?
Good question. I don't have that data in front of me, but from 2020 to 2023, falls increased from 700 to 900. So it's only getting worse. So an important project that she's working on, and now we're trying to square things up with where our site will be, who will be the donor of coffee. Lioness has donated to the health department in the past, and we're thinking about possibly using their donation to help support this program this year. That's all we have
Just
on
a quick
fall
question.
prevention.
Are more accidents because the break caused the fall or the fall caused the break?
Well, we used to think that the cause was the fall, but many times people are osteopenic
Yeah.
and they'll break it and then fall. So it's a dog apiece. It still ends up in surgery. I think now that our general practitioners and internists are more aggressive in treating osteoporosis, that is becoming less of a problem. I've been practicing the last 5 years, so it's hard for me to say, but when I left, I said it's a horse apiece.
Regardless, though, we know once they break their hip, their mortality rate dramatically goes up.
There's a 5% in the first 6 weeks of the fractured hip. And then we thought once we pinned their hip, they were home free. Well, Nails did a study and they found out that over that next year, they died of other things, 40% mortality rate, because they were on the edge and that was just enough to tip them over. So that the fractured hips and falls are a real problem for the elderly. Personally, I was taking, 3,000 international units of vitamin D, had a total hip done, and I had a fracture following this when at the base of the prosthesis. And then they did a vitamin D study on me, and I was, with 3,000 international units, I was hypovitaminosis D. I was like 30, I think I was like about 27, 28, 30 to 100. It took, now I take 15,000 international units just to stay in the middle. So you can't always go by what the recommendations are. They used to say 800, the standard was 800 international units is in the average multiple vitamin. Well, that was based on people that live where there's a lot of sun. If you went from Boston, Chicago to Seattle, north, most people by the time February rolls around are hypervitaminosis D because their face and maybe their hands will be exposed to the sun. So we have to rearrange our ideas as far as how much vitamin D we should be getting. Unfortunately, many times when you run the studies, they're not covered by Medicare, and they can run about $150 for a vitamin D study. That's what I paid about a year and a half ago. And for some people, that can be really can be very, very difficult for them to meet. But,
Yeah.
So what pills should
These
they
are
take
sharing.
in the winter?
You gotta talk to your doctor about that.
Yeah. Consult your PCP.
Yeah, find out where your vitamin D level is.
Is there any opportunity to provide the people who turn in the rugs with like a falls prevention course, or
Thank you for
where-
mentioning that.
Yeah.
Yes, because also the second part of this project is that we were creating a informational, kind of an infographic, kind of a flyer, like a toe in the water of education about falls, so that when EMS does their first, second, third call response, they can leave that with them, pin it up on the refrigerator, make reference to some kind of education, and then also reference Stepping On or the other programs that we offer through the health department. Thanks for mentioning that.
I suspect there's a lot of people that fall that don't report it. Even
Oh, absolutely.
For elders, they'll just stay in their apartment.
Maybe it wasn't a rug.
Oh, definitely. Yeah, there's other reasons, definitely.
Bathrooms, yeah. Okay, fall prevention, we'll move to park accessibility.
All right. We had Hayden from Medical College of Wisconsin do her preceptorship with us over the summer, and she did her MPH capstone as a parks accessibility project. So again, sorry that Hayden can't be here, but she just presented this to me, so it's pretty fresh in my mind. She came into the health department the other day to recap everything that went on over the past few months. So this started about a year ago when we were looking at the benefits of Kalis Playground and trying to figure out how we can implement that across the city without necessarily creating a bunch of new playgrounds. So it led us to the Accessibility Center in Wauwatosa to ask the question of if any type of audit exists where someone can come out and audit our parks or teach us how to do it, to identify what could be changed, added, are we doing well, room for improvement for the physical structure and outlay to make it an accessible space for a bunch of different people. From that project, we had done a deep dive into what type of tool might work best here, and we ended up on the AARP accessibility assessment, and then also we did a supplemental questionnaire through the health department. So we had it open for, I think, about 5 to 6 months, where we went out to different community groups and asked people if they would be willing to fill out the accessibility assessment. And we had responses come through, and Hayden themed them all. So she looked for common themes, like highest ranked things, lowest ranked things. Did a deep dive into the literature review. And I'll just give a very high level overview is we started it because, like I mentioned, we wanted to look for accessibility across Franklin, and also because a lot of people utilize the parks, which we know from our community health assessment, or they valued the parks, but not a lot of people utilize them. So it was one of the highest ranked valued things in our chat. But why aren't people going? That's So what we set out to find, in the literature, there was recommendations to look at parks, so at a general level, not just Franklin's, but repair uneven walking surfaces, add tactile indicators to walking areas, look at AEDs, keep restrooms and recreation areas updated, so things that you would probably think of off the top of your mind. We had our assessments done, she looked at them all, and things that came in for Franklin's, and we did update the Parks Department when we were mid-project, or Parks Commission, so they don't know these final results, but the final recommendations have to be weighed against, obviously, feasibility, financial resources, what the city as a whole would be interested in moving forward with. But there were areas that were noted for uneven walkways, so that would be an area of recommendation to repair. Implementing barriers or borders between park edges and streets, because some people noted that on their assessments. Add or modify existing play structure to improve non-slip surfaces. Add tactile surface indicators and other sensory safety features, so like a visual indicator at a crosswalk or an audible alert if the crosswalk was appropriate for that specific park. Adding emergency equipment, so AEDs or emergency alarms, and where applicable, adding crosswalks. Some of these parks are nestled in communities, so it doesn't necessarily make as much sense as in other locations. But overall, these are a lot of things to consider. So we have a lot of work to do, even though a lot of work's been done, and now having some conversations with DPW, the Parks Commission, the Planning Department, Health Department as a whole, to determine what we can do from here to make parks as a whole more accessible locally.
Any questions? If not, we're going to move to Laura.
Yay! Laura is here, so I will let her take it away. She has a handout to hand out today, or pass around today. But Laura, if you could do a little introduction about yourself, that'd be wonderful, and then the work you've been doing.
And congratulations, I hear.
Yes.
So my name is Laura. This is like my final part of my degree for my undergrad in public health from the University of Wisconsin-La Crosse. I have like 1 week left with the health department, so it's coming to a close. But I've had a lot of opportunities here. I've done a lot of things, which has been really, really awesome. So this flyer has just a few of the things I've done. So the first one is that I wanted to point out was a youth advocacy experience. This is brand new. I had the chance to write a lesson plan and kind of just an outline of the day of what they could do, what could be implemented here to just get the youth in the community involved, and just a chance to learn about advocating for what they believe in. And they would get to hear from local legislators and different guest speakers to learn about good government and how it works and different things like that. And then I have the How to Check an ID flyer. So this is actually a whole packet that I would like to share with the bars and maybe other places that sell tobacco or liquor. And it just is how to check an ID and what a fake ID looks like. It also has information on different ordinances and laws and just the fines that are associated with those laws if you sell to someone who's underage. So just a good, simple flyer to just hand out to all of your workers just so they can all be kind of on the same page with that. The Duck campaign is for Volition Youth. So this is something I took from La Crosse, actually. We did that there, but I thought it would work really well in the schools. So basically these little tags are put on rubber ducks, and then they can just hide them throughout the school. Then on the back of the tag is a QR code, and it goes to a little quiz that has information about tobacco and something else. Megan made the quiz, but it just is a way to share information, but also get kids involved in I can hide it and find it.
That's really neat.
Yeah, it's a little, and for some reason they love ducks. I don't know why, but rubber ducks are just in, I guess. And then these stickers are just for paper bag or plastic bags at tobacco retailer stores, just to be a big reminder, hey, did you check their ID? Are you sure they're 21? And things like that. Then this tick kit is something just kind of small, but a good way to get tick safety into the community. It has tweezers, Band-Aids, off wipes, little baggies, and then a little pamphlet that has information on what a tick looks like. It has the size of a tick, how to properly remove it, and what to do with it. And then the last thing is this fact sheet that I have on there. So it's just to share some information about what Volition is, how you can become a member, how you can get involved, and just some like facts of why we need Volition in our community, and different things like that. But I've done a lot here, so this is only a few things of the many things I've been able to do, and yeah.
Thank you, Laura.
Wow.
What questions does anyone have for her?
Well, I have a question. The tick kits, that's pretty cool. How did you disseminate the tick kits?
Well, I guess we found everything on Amazon, so that was nice, and then I just kind of put them all together. And I think we're going to hand them out at some bug something in September.
Yes, both looking at doing the concert series out here at Lion Legends, the Music in the Park, because it is under a tree canopy. And then also, yes, exactly what Laura said, Bug Day, that's happening at the Ware Nature Center in September.
I'm not sure what that is yet.
All right, well, that's
That would be a
pretty
good place to give
Yeah.
those at the Word Nature
Yeah.
Center, yes.
Right. Thank you, Laura.
Just also, the ID check, you have that for local bars. Are you doing that stores and that too, retail?
I think that would be a good idea. We haven't actually officially sent it out anywhere yet,
Okay.
but we did get the PD approval also, so their logo is on there as well, which is pretty cool. I'm hoping we can maybe do something with that by the end of the week, but we'll see.
Because I know a lot of bartenders are pretty familiar with checking ID, but not all clerks are.
Yeah, that's true.
You mean like Take and Save? Or?
Right,
Mhm.
right.
Oh, okay.
How many tickets are we anticipating putting together?
Laura, how many did you put together?
144.
144.
Oh, that's fantastic.
All right.
Okay, next question is when's the wedding?
Yeah.
It's in 2 weeks.
Okay.
Oh, wow.
So you're finishing up this week and then getting married the next.
And then I start my new job. So it's a lot.
Busy.
Yeah.
And what's your new job?
I'm a campus minister for the Newman Center up in La Crosse.
Oh, there you are.
I know. I
Mike,
was
you had a
sad we
question?
couldn't convince her to stay, but great opportunity.
Is it hard coming up with the packet numbers to put into the ticket?
No, I don't think so.
No.
It was pretty straightforward.
I mean, could you make 500?
Well, it was only me, but it only took me maybe 2 hours.
Well,
but-
Volition Youth could help do that.
True.
Right.
I think the barrier there is the funding.
Yeah.
Yes.
So
funded all
to
that.
see if I can't quite remember off the top of my head. Okay, let me think about that. Oh, our communicable disease grant funded the tick kit.
Is there
and
still
then-
resources in there?
You get the resources free from DHS, so we were able to order the pocket cards.
Because I was thinking maybe handing them out at Kayla's Park too, just on a day.
That's a good idea.
Just a Saturday morning when people are there and having fun. Good afternoon at Kayla's, hand them out there.
And they have those ambassadors too. Kayla's playground ambassadors. Very neat.
Right.
It's a great job for an intern to put those together.
Well, that's a
Well,
perfect
thank you.
lead-in to our next item on the agenda.
Yes, which would be upcoming internships.
Yes. Sad to have Laura's internship come to an end, and now we look forward to the next interns that are beginning with us. So we'll have 2 Franklin High School students this year. Both are Volition Franklin youth members, but then reached out additionally to learn more about public health and do their, I guess I don't know exactly what they call it, but they have an hour in their high school day that they can come and do a work apprenticeship. And so they'll both be doing that, and it's every other day for about an hour each time that they come in throughout the entire school year.
Wow.
So they'll be working with us on a variety of different things. And then we also have a Master's of Public Health student from the University of Nevada, Reno, completing an 150-hour internship, and that individual will be primarily focused on our immunization program and doing a deep dive into benchmark immunizations here in Franklin, and then evidence-based ways to increase childhood IMS.
Will they physically be here?
She will. She lives in Oak Creek, and she'll be here for about 20 hours a week throughout September and October.
Okay.
Don't ask me where, because our department is like very small with limited space of seats. But Laura was over here. We wish that she could be a little closer, but yes, we will have our intern on site for the majority of the time.
Okay, if there's no other administrative updates, we're going to move into clinical service updates and clinical services.
All right, clinical services. Major update we have, not for this last quarter, but looking into the future, is our flu clinic coming up. So we're getting excited about that. So we have the Adult Health and Wellness Fair coming up, as well as a variety of other flu clinics starting about the last week in September and running through October, because that's when we have found the highest demand and when we prefer to give the flu vaccine. So that's on the horizon. We delivered immunizations throughout. I'm focusing on quarter two because that's how we've broken these up for our Board of Health reports, but in quarter two we gave IMS 80% was TB. We did 80% of our TB skin tests. So that's high demand always. So both people that are starting new jobs, college students, wide range of demographics of individuals seeking services here. And then I'll hop into our communicable disease report. So in quarter two, we had the majority were respiratory and STI. You'll see the breakdown on the second page of, or the back page of the next sheet. And then just highlighting news on communicable disease, and then our new public health nurse. So Caitlin has started with our department, and she is diving deep into communicable disease. So that'll be a major part of her role as well. Amy and Jamie are still sticking with the IMS program and leading that as a whole, and then Caitlin will be learning up on all there is to know about communicable disease and clinical services.
Any questions on clinical services? Now we'll go into, well, you kind of covered communicable disease report, so we'll go right into the health department updates.
All right. In quarter two, so April through the end of June of this year, we have a highlight of a look back on everything that happened. We had Boost Your Brain and Memory. That's always been very well received here, so we have a wait list always running on that reached about 40 seniors. We had a safety day, which now seems like years and years ago, but we had that in May with the Franklin Fire Department, police, Volition, State Farm, where individuals could drive their car through the fire station 1 and then get their car seats checked to ensure proper fit. And you were a social guest there, actually, now that I'm remembering.
Yeah, my family attended. It was very nice.
Good.
And we provided educational resources. There were 6 senior wellness workshops, emergency preparedness tabletop. So we did a multi-jurisdictional tabletop with senior living facilities. So all of ours in Franklin were invited to come to ensure that we all had the right lingo and knew what we would do in a winter weather emergency. So if they were to lose power or not be able to leave because of being snowed in, what that response would look like locally. Volition Franklin and the health department hosted our joint outdoor movie night. We had our bike rodeo with over 80 families, so that was great for bike and road safety with our huge supporter of the PD, the police department. We kicked off our Parks Passport. So this is an initiative that came out of the Community Health Partner Network, so that group of individuals who works on our Community Health Improvement Plan. It's about 30 organizations that come together quarterly, and we were trying to entice people to use our parks. So same reason that I mentioned before with our CHA, with our community health assessment, many people value our parks, but not a lot of people mention that they use them. So how do we drive traffic there? We kind of doubled this with our multi-generational goal. So our goal to get grandparents and grandchildren together more, and a lot of people went out and did it. So they went to different playgrounds around Franklin that you created. Did you create this? Lindsay created this. Yeah, okay. And you collected them all, and they were at National Night Out collecting them. Oh, and here's Laura holding it, actually. So people went to the different parks and were to answer specific questions about each park. So very simple things like, what color is the slide? what drawings on the bench, just so they show that they visited. And then Kayla's Playground donated a gift basket for a raffle.
Aw.
And Shelly Renty with Kayla's Playground also connected us with Franklin High School, who the students there printed stickers that says I love Franklin Parks, and people who turned in their parks passport could get one for free at the health department. So that was really great, and a lot of people provided feedback that they loved it and wanted it to happen again. So we're looking forward to collecting all the survey results on that. We hosted a multi-generational gardening workshop at the Botanical Gardens. So youth with an adult, a grandparent preferably, but also could be a parent, would come and get a free workshop where they planted basil seeds and could walk the garden and learn about gardening as an opportunity to foster a further relationship. And then we had our tobacco poster contest and a huge number of 110 inspections through our licensed establishments. So that was a lot of different community initiatives that were going on. So that's some of the education that we provided.
Okay, any questions? Anything else on health department updates?
I kind of hopped down to emergency preparedness. So I mentioned that a little bit, but that was a really huge feat for us to have that multi-department combined meeting about the weather emergency, and it was such a fabulous response. So we had Franklin Fire Department, Police, Health, Greendale, Fire, Police, Health, and then our senior living facilities. It was really great. So we were able to look at our plans and kind of poke holes in where we might want to improve for the future. We've been working on an MOU for a warming and cooling center so that we could have an additional center stood up in case there was severe winter weather or in these hot summer months. If people's air went out, there was a power outage, we needed to help people find a place to stay cool. So that's in the works. This wasn't technically in Q2, but we made it through the RNC. So that was a lot of planning. So we've been working with our local partners to shore up our point of dispensing. So that's that mass, either vaccine or medication dispensing. So that's in a really great place. So a lot of preparedness has been happening in the health department and will continue to happen.
Okay, and then you mentioned a little bit about inspections, but
Yes, on the bottom of the first page in this newsletter, you'll see that we had a breakdown of our Q2 inspections. So we had 241 total 110 total inspections. So they were broken down by routine, which is about 80, follow-up, so that would be if someone had something that was a critical violation that we needed to follow up on. And then we also had special, so this might be something that not everyone knows, but if an establishment loses power or there's a fire or an incident there that affects their food service, the Franklin Health Department goes out and does an inspection to clear them to reopen. So we did have both the power outage and fire to respond to in Q2 of 2024. And then you'll see it on the Q3 report because the stuff's in June, but a lot of food trucks. So we did a lot of inspections on special events and food trucks. In pools in the summer, always. And then this is just for your own knowledge. The next page is service breakdown. So I don't have necessarily an agenda item, but it's just a continuation of this report in case you were curious. And it talks about the breakdown by Aldermatic District as well.
does anybody have any questions, comments?
Just one.
Yes.
Okay. Keep blurting stuff out.
No, please.
The health department is intentionally involved with the VEST program. How is that going? Is that
It's a huge response. So the Lions Club and
does everybody
PD.
know about it?
I don't know what you got.
The Lions Club, the police department, and the health department have created a reflective vest that can be given to people when they walk their dogs.
I've seen a lot of them.
So I'm just wondering how that's going.
It's a huge demand. So we have a box at the front counter that Lions Club and PD Officer Wallace has been a great partner in that. Distribute, walking vests, and a lot of people come. We continue to run out.
Oh, yeah?
So it's huge,
So when
hugely
that goes
Is that
beneficial.
distributed through the health department or?
Well, it's PD is
Noon
distributing
Lions
them. Noon Lions is running it.
PD, Franklin PD, and the health department. The library involved with that at all?
I don't know if they're a collection
So
site or
the
not.
Noon Lions funded it.
Yes.
Oh, thank you.
Yeah.
That's fantastic.
But I'm just
Yeah.
wondering if there's a 2XL
What's
left.
that?
Oh, I can look when we're done.
That's what we're
I
finding
tried to
out.
get one at
Police
the
department, health
AMA.
department.
Oh, yeah, let's look at
Or
this.
the New Lions Club.
What does Jake, what size is?
A large.
Dr. Relevich is wondering how you acquire a vest.
You can walk across the hall with me.
Just walk across the hall and get it.
Okay,
I'll check the box. I haven't looked in there lately.
Maybe we
However,
all need to walk across the hall with you.
Yeah, bring back one
or
for
I'll
my
just
wife.
bring the box.
Yes,
Yeah.
or that.
And then
But
New
the
Lions also
Franklin
have
New
a
Lions,
survey.
I'm part of
That's
that, so
awesome.
I'm just looking for, I'm sure we're willing to renew it.
Oh, we've already had to have another drop off.
Yeah.
We have to continue to have our box filled.
Yeah.
Okay, well, that's good to know, so it is a success.
Yes, I would say absolutely. I mean, I'm only one person,
Yeah.
but based on the numbers of them going out the door, I would say it's highly successful.
Maybe
How
some,
How do people know about this?
yeah.
Pick this
that was
up?
my- that
It's
was
word
my
of
Don't.
question.
Police
okay.
department, the library, I think it's telling people.
Health department has
Was
put
it in
some
the newsletter?
information out.
At the safety day, it was highlighted that they would be given out,
Sure,
so
okay.
people could grab them then.
Maybe a recap of how many total that have gone out. You know,
Well, that would be Lions
Oh.
Club that would know that.
But maybe we could publish, I mean, you're the main distribution point for it as well as the PD, so
All right. Sounds good. We can look into that.
be just an FYI sharing stuff
Yeah.
that you're involved with. Kudos.
Yeah, thank you for the invitation to be a part of it. It's fun. The first week that traffic picked up, we thought, wow, we're so popular all of a sudden. Everyone wants to be in here. Those vests have worked wonders. But it's been great. Yeah, happy to do it.
I'll beat you across the
Were you gonna bring the box in?
I'll
You
bring the
just
box.
said
Okay.
it. Come on.
Well, I just had my knee, so.
Yeah.
All right. All right.
All right, that's all I have. But if there's more questions, happy to
Yeah.
answer any.
Any other items? And we need a motion to adjourn.
Motion. I'll second.
And no discussion? All in favor?
Aye.
Okay, unanimous.